Good morning. Dr. Alex Nataros here, Facebook Live. Thank you very much for everyone for joining. We've got a number of questions that are already up, and I just wanted to share a few things. My name's, as I say, Dr. Alex Nataros. I'm the family doctor, medical director at North Island Community Health Center in Port Hardy. We serve, over 4,000 patients and provide 4 different family doctors. We've got allied healthcare professionals, including registered massage therapist, occupational therapist, 2 physiotherapists, and what else? Orthotics fitter, foot care nurse, and newly announced a counselor psychologist. So so that's a little bit about myself. I'm based in Port Hardy, serving the North Island. Physically, at this very moment, I'm in Kelowna, where my partner just had a child. We've had a baby girl, and so I'm supporting her with a lot of her family based here. So the goal today, this is a office hours. So what does that mean? As part of my 4-year undergraduate degree, 4-year undergraduate medical degree, and then 5 years of residency training, so 13 years of post-secondary training, we would have office hours, which would be with the physician assistants or with teaching assistants, and they would run, be an open hour where patients or learners could come and ask various questions. And so that was all part of, opening up and, as I like to say, democratizing healthcare. And so opening up some of the unknowns of what it means and what it looks like behind the sheets, right? And I apologize, I'm a little bit sweaty this morning, just got back from my run, was a little bit closer to the start of this Facebook Live than I would have thought, so you'll have to bear with me, a little bit of sweat on my brow, but certainly activity promotion is a huge part of what I'm trying to do. And so certainly that's a big part of what we're doing here today is activity promotion, talking about misinformation, breaking down barriers, breaking down unknowns, and as a family doctor, as I say, with over 13 years of post-secondary experience and now 13 years of work as a physician, there's a lot that I hope I can offer in terms of my experience. I see consistently 40 to 50 patients a day, so there's a lot of stories, there's a lot of things that come in there, and so we've got first question on the board in terms of one of our main supporters. A young female friend badly beaten in her face a few months ago. Her optical bone in her eye was broken and she had a concussion. Recently she had a seizure. Could this be a result of her beating? And is it likely to have more seizures? Well, first of all, wow, that sounds devastating. I'm very sorry that she was badly hurt. I hope the authorities otherwise were involved and there's some responsibility for what happened to her. Yes, post-traumatic seizures are a real thing, and post-concussion seizures are a real thing. So what I'd encourage her to do is seek medical advice, and certainly urgently she needs a CT scan of her head and probably what's called an EEG, an electroencephalogram. And so that's something that can be very helpful in terms of just figuring out why the brain is irritable and what happens with seizures and seizure activity, including epilepsy, which is a more genetic, can be acquired, but more genetic component of seizure disorders, is that basically you have irritability in part of the brain. And when we do an electroencephalogram where they put stickers on the brain, similar to an electrocardiogram where we put stickers on the heart, that looks at the activity of the brain. And sometimes people have this done at night, so a sleeping EEG, and that looks at areas of the brain that are excitable. And there's classic, fingerprints, thumbprints in terms of what a brain that is predisposed to seizures looks like. With a concussion, and concussions are something that we're only starting to finally understand, and over the past decades there's been contradictory thoughts in terms of, are concussions, do they last a long time? Are they short acting? What's the impact on mental health? What we've come to understand is that there's neurotransmitters, there's signals that are sent within the brain after brain damage, including a concussion. And by definition, typically a concussion isn't visible on a CAT scan, a CT scan of your head. But, some of the understanding that we've gotten to is that there is irritability, there are these neurotransmitters and hormones that are released that can lead to seizures potentially after traumatic head injury. So mostly I hope your friend's doing okay. I'm glad to hear that you've mentioned here that the perpetrator was charged and found guilty and held accountable. So that's very helpful. Just opening up again as these office hours work. Feel free to put in the chat any questions that you have, issues related to health and wellness, maybe, issues you've faced as a patient, issues you've faced with family members who've sought care. My goal is to break down some of the barriers, break down some of the unknowns around health and wellness. Maybe you've got questions about supplements, and, I'll do my very best to try and answer them. I think, part of this project is pushing back on the misinformation in the world. And what we see right now is there's an upsurge in measles. And so we've got measles outbreaks in Ontario through parts of Texas, and even upsurge in cases in Alberta. So that's concerning, particularly to me. I've got a young daughter who's too young to be immunized. She has some protection from the antibodies that flowed from mom through the placenta, but it's a concern, right? And so, there's a lot of misinformation right now in the world about vaccination. And what I can say unequivocally is that vaccines are, other than drinking clean water and having access to toilets, the most important accomplishment we've ever made in health. If you haven't got your measles vaccine, if you're not sure if your measles vaccine's up to date, make sure you check with public health, check with your doctor, get up to date. That's important. Okay, we've got another question coming in. I'm just going to pull it up here. It's related to osteoporosis. And so osteoporosis is, by definition, a weakening of the bones, the architecture of the structure of the body. And what we know about osteoporosis is it is age-related. And there's various risk factors for it. First and foremost, with osteoporosis, it's really important that you do weight-bearing exercises, that, lifting weights, no matter what the amount, helps. Doing physical impact, so walking, running can help. Swimming is important in terms of putting stretch on the muscles, but it doesn't help as much. You can think of, strengthening your bones as being similar to strengthening your bones. Strengthening your bones is being similar to strengthening your muscles. Where if you go to the gym and you're lifting weights, you're causing micro tears, little tears in the muscle, and that leads to growth in and rebuilding of the muscles, and hypertrophy is what we'd call in medical terms. Similarly, in bones, when you're impacting, if you're running or walking, you're creating many small, tiny fractures in the bone, and that sends signals to rebuild the bone and strengthen the bone. And so that's the basic principle in terms of osteoporosis, is we want to strengthen the bone, we want weight-bearing exercises, we want aerobic exercises. That's first line. Now, in terms of, next step is who's at risk. And that's a very good question. And so what I'd say, and I'm just pulling up an example here, patients at risk for low bone density, which is osteoporosis, are patients that have been on steroids, glucocorticoids for a long period of time. So for example, if you have chronic obstructive pulmonary disease, COPD, or emphysema, if you smoked a lot and have been treated with steroids, if you're asthmatic, these are all issues that may lead you to be on steroids for a long period of time, and that might weaken your bones. Other issues that may lead you to be on steroids include rheumatoid arthritis, any autoimmune conditions. So these are all reasons to check with your provider and see, right? And that might be reason to have what's called a bone mineral density test. And that's a specialized test, and one of our viewers and main supporters had asked about that, and I'm happy to circle back with them one-on-one as a patient. But it's a really important test to have if you're at risk. Now, not everyone needs a bone mineral density, but as I say, if you've had, prolonged course of steroids, if you've had, I'm looking at the other risk factors, a parent with a fractured hip, if you have smoked a lot in your lifetime, or if you drink a lot of alcohol, and I mean, over 3 drinks a day for a long period of time. These are all risks of osteoporosis. Also, obviously, if you break bones, and you tend to break bones, maybe you should talk to your doctor and get this test done. Bone mineral density is essentially a fancy x-ray, and we check the density of your bones. And so, that's all part of checking to see if you have osteoporosis. And by definition, osteoporosis is age standardized. So what I mean by that is that there's a score for someone who's young, healthy, otherwise, called a T-score. And if you're 2.5 standard deviations, which is a fancy statistical term for 2.5 points removed from the average otherwise healthy person, then we diagnose you as having osteoporosis. So first step in terms of osteoporosis, like I said, weight-bearing exercise, aerobic exercise. Next step is making sure that you have access to vitamin D supplements. So if you do have osteoporosis, I'd recommend 2,000 units. That's 2 of the vitamin D tabs daily. And then making sure you're getting at least 500 milligrams of calcium in your diet, and you may need a supplement for that. That might be helpful. So these are key components. Then the question is whether you need to take a special medication to strengthen your bones. And there's 2 main classes. There's something called a bisphosphonate, and many of my patients with osteoporosis take this. Typically, you take it once a week. And an example would be alendronate. Another example would be rosendronate. So this class of medication decreases the breakdown of the bones. And as we can think, your bones, your whole skeleton turns over at least every 10 years, which is amazing, right? You think of seeing a skeleton, in the classroom, or you can just, picture a body's skeleton. And it seems like it's static, seems like it doesn't change. But in fact, the whole skeleton turns over because there's a balance of 2 types of cells. And you can think of it kind of like a game of Pac-Man. There's the osteoclasts, they're the ones that chew up the bone. And then there's the osteoblasts, which produce bone. They produce bone. So it's a balance of consumption of bone and production of bone. And that is what makes sure that we have strong bones, that balance. Sometimes that balance is, out of whack, and for various reasons, including what I've mentioned, prolonged steroid use, excess smoking, excess alcohol intake, even just genetics, having a family history. And so, with that, a bisphosphonate may be an option. There's another newer class of medication, it's a bit expensive, but covered by most drug plans, called Prolia, or denosumab. And this is a monoclonal antibody, and it literally blocks the consumption of the bone by those Pac-Man, if you will. And it's something called a rank ligand that blocks onto it. And so, that can be helpful. That's an injection we do every 6 months, so it's very convenient that way. But as I say, it's quite expensive. So osteoporosis is something to be aware of. One of the trends, and what I can say, and part of my goal with this Facebook Live series is to break down some of the unknowns of healthcare and what it is to be a doctor. And part of that is recognizing that things change and the science changes. And so, we evolve, we learn, and we adapt. And, that's part of the importance of having science underlying medical care, is that science is constantly trying to prove itself wrong. And so you're constantly testing against what's called a hypothesis, which is a test that you're generating. And so we constantly want to try and prove, that we're wrong. And so it's a self-correcting approach. And so just with respect to osteoporosis, as I've been talking about, which is weak bones, we used to do tests on everyone. And what we've learned is that actually our treatments aren't that effective. So like I mentioned, the bisphosphonate, the Prolia, denosumab, really doesn't make that much of a difference. If you've got, brittle bones from advanced cancer, or say, metastatic disease, you've got cancer in your bones, then it may be an option. If you've got really, really weak bones, then it may be an option, and you've broken your bones before. But for most of us, the best we can do is take vitamin D, 1 or 2 tabs if you're weak bones, do aerobic and weight-bearing exercises, and stay active, right? And, mental health is key to all of this. And, I've come across a number of patients who've been told by their providers, oh, you've got weak bones, you shouldn't be doing this activity or that activity. And, in my humble opinion, that's misguided. We need to keep active. We need to maintain our mental and physical health at all costs. And, life is, by definition, full of risks. And, other than keeping yourself in a bubble, you're always going to have certain risks. So I'm just looking at questions. We've got lovely comments. Thank you very much, everyone who's weighing in. We've got a question here from a patient. How much B12 should a woman take in her 60s? This is a very good question, and one I often get. Vitamin B12 is something that you should have checked. If you haven't had checked in the past 2 years, check with your doctor. There's a lot of medications that we take that cause B12 to be low. For example, if you have gastroesophageal reflux, the class of medications called proton pump inhibitors actually block the absorption of vitamin B12. And so that can lead B12 to be low. There's certain people with autoimmune conditions, something called pernicious anemia, where their body just doesn't absorb B12, and B12's absorbed in part of the intestine, but there's something produced in the stomach called intrinsic factor that's required for the absorption of B12. I know we're getting in the weeds here, but that's sort of back to basics of medical school, but that's necessary for absorbing B12. So there's different ways and different reasons that B12 can be low. So asking, as a woman in your 60s, how much B12 should you take? Well, typically, if you need B12, if you're told you're low in B12, you should take 1,000 micrograms a day. That's one typical tab, orally, daily. You should take that for a 6-month course and then have your B12 checked again, because there's some people, for the reasons I explained, that don't absorb B12 and can't absorb it orally. And that's the reason that they need to get a shot, get an injection, and that's called an intramuscular injection of vitamin B12. And that can make a big difference. Low B12 can lead you to have numbness in your feet, numbness in your hands. It can lead to fatigue and profound, unwellness. And so that's all part of assessing, someone in their 60s, making sure their thyroid's okay, their B12's okay. But to your point, first of all, have your B12 checked. There's a lot of people I see that take B12 just because they assume it's a good thing to do. It's not true, and you should have your B12 checked. I'm not aware of any harms of taking one B12 a day. So, if you haven't had it checked and you're taking B12, I wouldn't lose any sleep over that. Probably just contributing to expensive pee. But, have it checked. We've got a few other comments and questions. And please, as you're watching, think about questions that might be helpful and put them down below in the chat. So I've got a question about thyroid replacement. So can Synthroid be taken with daily vitamins? Yeah, so, Synthroid typically is best taken on an empty stomach. I'm not an expert with respect to pill administration. And that's a good question for your pharmacist. I worked very closely with our pharmacist in Port Hardy at Hardy Bay Drugstore, Kristen Ireton, as well as over at Rexall. But they're the expert in terms of administration of medications. But Synthroid should be taken with an empty stomach, can be taken first thing in the morning. We talk about thyroid replacement. Thyroid replacement is common. It's one of the most common chronic conditions that I see in my office is acquired hypothyroidism. And it's, I don't want to, again, get too far into the weeds here with this, but basically it's common to have an autoimmune condition. There's a couple. There's Hashimoto's thyroiditis, where your thyroid gets overactive from an autoimmune condition, or there's Graves' disease. And basically the result of these is that you need to have thyroid replacement. And there's different thyroid formulations. You can have animal acquired or synthetic thyroid. Synthetic thyroid is Synthroid. And it's important to work with your doctor on getting the right amount. So, Yeah, so make sure you guys put some questions in the chat. As I say, this is the office hour, an opportunity for questions around issues of health and wellness. Any you've got. I'm not saying I'll be able to uh, answer them, but I'll do my best and certainly consult whatever sources I can right here in front of me and reach out, call a friend if I need to. There's a lot of things that I learned in my 13 years of post-secondary training to become a doctor. But most importantly is an approach. How do you approach and learn how to answer questions, right? And how do you do so in an evidence-based manner? That can be helpful that way. We've got a comment here around the Synthroid follow-up, not to take it with multivitamins, taken at least 4 hours apart, or they will bind. So there are certain metals in multivitamins that can delay or impact the absorption of hormones and neurotransmitters and supplements as well. So just be aware of that. But I would agree to take that Synthroid on an empty stomach first thing in the morning. If you're taking a multivitamin or taking iron supplement, to take it separated by a bit of time. And we've got a comment. Oh, I think my daughter Rose was heard in the background. Anita commented on that. And so, what else can I say? There's a lot of challenges in our healthcare system today. We're in a federal election right now. Make sure you get out, get involved. I don't know who I'm going to be voting for, and I certainly, have tried to engage with my local candidates in Port Hardy in the North Island. I think it's important that we do get involved because healthcare is a political issue. It shouldn't be a partisan issue. It shouldn't be owned by a political party. But health is political. If we're not, if we aren't in good health or our loved ones aren't in good health, it's entirely consuming. And so, much as having an income or having some source of ability to feed ourselves, having good health is essential to being able to function. So get involved in the election, vote, vote, vote. Here we've got a great question on the board. My mom is 60 years old. What should she be taking for high blood pressure and no sleep at night sometimes? So, this is a very common question. One thing we see is with people as we get older, especially into our 60s and 70s, our circadian rhythms. So the amount of sleep that we require decreases. And yet often we're, tied to this sense that we need a certain amount of sleep so that, we need to have our 8 hours that we learned we needed or maybe we had when we were younger and working. That's not the case. So as you get older, you don't need as much sleep. And often that number goes down to 4 to 6 hours. Sleep can be disrupted where you're waking up through the night. So first of all, to the question, no sleep at night, that's obviously an issue. And if you're not sleeping at all, it's an important issue to raise with your medical provider. I'd say a first step would be melatonin. So you can get melatonin over the counter. A couple things with melatonin. More is not better. So actually, if you take more, it can lead to rebound difficulty with sleeping. So you don't want more than 5 milligrams of melatonin, and a controlled release form is good. So talk to your pharmacist. Controlled release melatonin, 5 milligrams is a good option. So that's a good first step. There are sleeping medications and ones that have minimal side effects, something called Dayvigo or Lemborexant. That's quite effective. That's new in the past couple of years. It's well studied. In terms of high blood pressure, high blood pressure is the leading cause of heart attacks and strokes. And so the reality is it's common and it's treatable. So, one of the things I encourage everyone to do is go get your blood pressure checked. And next time you're by the pharmacy, typically pharmacies have a blood pressure cuff, just put your arm in. Don't lose any sleep if it says it's high, but take it a couple times. Maybe it comes down, right? Any one of us can drive up our blood pressure if we're stressed. But, after you've taken some deep breaths, maybe meditated a little bit, taken 5 minutes, take your blood pressure again. And if it's consistently above 140 systolic, which is the top number, then probably a good idea to talk to your doctor. So, in terms of the question of what you should be taking for high blood pressure, There's four main classes of blood pressure medications. They work differently. There's, classically diuretics where you pee out a bit of the excess fluid. That can be disruptive to some people, especially those who struggle with incontinence issues. There's other medications called calcium channel blockers. They work by relaxing the smooth muscle in the blood vessels in the legs and arms and allow your blood vessels to open up, allow pressure to go down. So those are all, components. There's a class of medication called beta blocker, which essentially relaxes your heart so it's not pumping as hard. So, to your question, it's important that she have a discussion with a healthcare provider and certainly try and target her blood pressure to be under 140 systolic. If she's got diabetes, if she's got chronic kidney disease, so again, those are things that can easily be checked with a blood test. She should have that number actually less than 130 systolic, that top number. So we've got another good question about the importance of diet. So, there's no health without dietary health. And food really is medicine. I'm a huge believer of that in terms of what we put in our body. I'll take a little break here. I've got my apple a day. Apples aren't the best fruit, but they're pretty good. And it's always good to eat fruit rather than drink fruit. So, eating fruit gives you fiber. It's slower to digest. It lowers your glycemic index. And so it can be a very important component of slowing your digestion down. So further questions around diet. I'd really recommend time and time again, and this has been studied, millions of people have been studied in terms of different diets. And you hear about fad diets. You hear about sort of the Atkins diet, the South Beach diet, all sorts of regional diets. You hear about high carb diet, low carb diet, high fat diet, high protein diet. But, when we look at all the studies that have been done, everything comes back to a simple answer, which is that the Mediterranean style diet over and above wins out. And so what the Mediterranean diet is, you can think of, if you think of people that eat in Italy or eat in Greece, what are some of the things that they eat? So typically fairly low carbohydrate, and yes, room for pasta or pizza here and there. And so otherwise high in good oils, so olive oil, avocado oil, high in fruit and vegetables, and certainly more vegetables than fruit. And then in terms of meat, some red meat, but, limiting red meat. More, lots of fish, so sort of more towards a pescatarian diet. Lots of, chicken, poultry may be an option. So, Mediterranean diet, Google Mediterranean diet. As I say, Dr. Google can be very helpful in knowing the right question to ask. So, let's do this together right now. So I'm pulling up my browser and Googling the Mediterranean diet and see what it pulls up. And you want to look for an academic source if possible. So one of the first things that comes up is the Cleveland Clinic, which is an academic source. And sorry for the background noise, that's just my partner who's a little bit upset with my dog at the moment. And apologize for lack of sleep sometimes as new parents. And so the Mediterranean style diet, is something that is very evidence-based, and I'd certainly recommend that. So if we Google, Dr. Google, Mediterranean diet, Cleveland Clinic is a really good option. There's other things on your first page of Google, Harvard Health, A Practical Guide to the Mediterranean Diet, heart.org. Something I had mentioned that I'd recommend, dietdoctor.com, can be quite helpful in terms of a Mediterranean low-carb diet. And again, when we hear keto diet, what does keto diet mean? It means high protein, low carb. And when you look at something like a Mediterranean diet, that is, predominantly a keto type diet. but there is room for carbs, and what I'd say overwhelmingly is everything in moderation, including moderation itself. So another question, actually a follow-up, we had that the patient that was struggling with high blood pressure and insomnia had a stroke. I hope they're doing well and have recovered. One of the things that we certainly know is that having a stroke can release brain signals and neurochemicals when there's damage to the brain that can lead to issues with sleep. It may actually relate to high blood pressure as well. I'm not aware of that, but certainly worth following up. And if she's had a stroke, she certainly needs to have medical attention and make sure she's on a blood thinner, make sure she's got good blood pressure control. With a history of a stroke, I'd say really under 130 or even 120 for the top number. We've got another question on the board, and just keep, as you're watching, keep reflecting on what questions might be helpful in terms of your experience either in the healthcare system or with your own health, questions of health and wellness, and please put them in the chat so we've got something to keep us going. So we've got a question here. An 80-year-old friend has had Graves' disease that's been dormant for years until recently, now diagnosed with kidney disease. Does Graves' disease attack organs? So, good question, but I'd reassure you that no, Graves' disease does not attack organs other than the thyroid. So it impacts the thyroid function, but as far as I know, Graves does not impact other organs. But, as I say, this is a good chance for us to do a little review, and I'm learning as we all learn, and so I'm just going to pull up a quick review of Graves' disease. I've got a medical source here called Up to Date that I like to use in terms of medical reference, but again, a Google of Graves' disease and looking at, say, the Mayo Clinic or Harvard Health is a good option. So yeah, again, it looks like it targets the thyroid, associated conditions. Sometimes you can get, and I haven't mentioned it, the autoantibodies, and more it's the hyperthyroidism can affect the eye. So you can see sometimes with people with severe Graves' disease, their eyes tend to protrude, come out, and sometimes you may meet people that have had thyroid issues and they may have a little bit of bulge in their eyes. So I wouldn't be, to your question, I wouldn't be worried about attacking other organs as long as they've got good thyroid control. I know I say don't drink your fruit. I'm having a little grapefruit juice, but I water it down quite a bit. Other questions, make sure you put them up in the board. Let's make sure we get everyone covered. And yeah, really appreciate everyone joining this morning. Good opportunity for us to cover issues of health and wellness. So much misinformation in the world right now in terms of supplements, in terms of anti-medication establishment. I think, as having a quick chat on mental health might be helpful. There's a lot of misperception around the use of antidepressants. So, this is something that's worth considering if you're struggling with low mood or significant anxiety that's impairing your function. And in general, my question with mental health issues always comes back to function. So if you have anxiety, that's part of living, right? We all struggle with anxiety at different points in our life, but are you getting out of bed? Are you, do you have a job, or are you functioning as, a caregiver or looking after an animal, a loved one? Are you doing something that gives purpose to your life? If you don't have purpose in your life, if you're not loving or being loved, if you're, really just not getting out of bed every day, that means you're not really functioning, and that might be reason to seek medical help. And so in terms of antidepressants, this is something that I see a lot in the world. Is patients that come in and they say, no, I'd never want to touch an antidepressant. And, I heard blah, 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 that it causes me to be dependent, or it causes me to be, to be numb or otherwise. And the reality is the most common cause of numbness for people with mental health issues is the mental health issue. And so is the anxiety, the depression, the bipolar disorder, the schizophrenia. And these need to be treated appropriately. And we've come a long ways in mental health care. So part of the challenge is what you see online is often, years or even decades behind in terms of the current evidence and the current medications that we use. So, today we've got great options if you're struggling with anxiety or depression, medications that can help by just, toning down that level of noise, of sense of overwhelm, of anxiety, and give you a chance to take that breath and be centered again and really get a sense of, what is it that's bothering you. And the goal with all mental health and physical health is to come back to a mindful moment. And so how can you be present in the moment? And that's a huge challenge for all of us, right? Whether you have attention deficit hyperactivity disorder, ADHD, or whether you're just living in the present world. Many of us, most of us have phones, most of us have devices, and these lead to distraction, and they lead us to not be present in the moment. So again, that's a risk for mental health issues. So if in doubt, take a breath, try and come back to the moment. Yes, medications can help you be present in the moment. And if they are helping, then that might be a good option. I've got another great question from one of our key supporters and one of my patients. Can you comment on meditation and yoga controlling blood pressure and other good results of these practices? So, I was speaking to mindfulness. That's something that, I go through periods in my life where I have a more established practice. Right now, my main mindfulness practice is running, but I have done a lot of meditation training and have done some yoga training as well. When I took my dog out for a walk this morning, my partner was doing yoga, and she's a big believer in that as well. And so, in terms of yoga, we know that a regular yoga practice, as far as it's studied, can lower blood pressure by about 5 points. 5 points. So, for example, if you were 140, it can lower it to 135, and that can be significant. And so, these are good practices in terms of lowering your stress, lowering your cortisol, and flexibility as well. And one of the big pluses of yoga is that it's got mental and physical health benefits. And so there's the mindfulness aspect, but there's also the flexibility. There's fall prevention, and we see that with yoga, with Tai Chi, with Pilates. And so these are all really, good practices that I'd encourage. And sometimes it can be social too. You can do yoga, on your own with a YouTube video or with an online class or app, but you can also get together in community. And so in Port Hardy at the Rec Center, we have yoga classes put on by a friend, Trish Fossum, who does a terrific job and helps build community. And so these are all parts of it. So we've got another question on the board from an old high school friend. I use antidepressant. Now and have learned some skills, and the anxiety is reduced significantly. So I appreciate you sharing this. It's, always courageous on issues of mental health to share. And this is how we break down stigma. So one of the things that we do at the North Island Community Health Center is we have group medical visits. And this is an opportunity to get together in a group and talk about what works, what doesn't work, and learn from one another, and then also talk about medications and side effects, and realize that we're all struggling, right? And there isn't a person in the world today that doesn't at some point themselves or someone they know struggle with mental health. That's just a reality. And so it's much better, rather than pretend it doesn't exist and create stigma and turn into the shadows and avoid discussing, to bring it up. And so I appreciate the courage here of this question. So yeah, learning skills, and one of the things that we can see is that antidepressants can help do the work, the cognitive behavioral therapy, the dialectical behavioral therapy, so CBT or DBT skills work that lets you get better and lets you be more resilient in terms of bouncing back from the various traumas and bumps that happen in life. And so, that can be a very important tool. So in terms of, when you've gone through a period of taking an antidepressant and you've done the work in terms of cognitive behavioral therapy or DBT, these are all very helpful tools that can be helpful. And, it may be worth reassessing with your healthcare provider whether either a wean of the medication, and typically antidepressants are good to wean off because there can be rebound effects if you just stop cold turkey. So you can wean down, take a partial dose for a week or two, and then, lower dose and then go off. But you should do that under the supervision of a family doctor or healthcare practitioner. But it's really good to hear that, that your nervous system's recovered and that you've got ability to focus. Again, to the previous question that was asked, certainly yoga, mindfulness, meditation can all play a role in that. We've got about 15 minutes left in this Facebook Live, so I'd really encourage you to put some questions up on the board. It's great to see some comments, encouragement, and really appreciate everyone joining here today. We've had, about 30 people join today, currently have 13 that are on. So, great to have you on board. Make sure, you put in the comments any questions that you've got. Maybe there's something you're uncertain about your own health. You don't have to identify your own health issues, but you can certainly share general comments, and I certainly won't name you. So there's a question here. It's sort of specific video that I was involved with in terms of the rising drug use in our town, Port Hardy. It's asking about a specific individual who was an interviewer. I'm not able to identify that person, so unfortunately I can't answer that question. Next, we've got, thanks for your info about cortisone injections for osteoarthritis in the knees. I'm having both trilateral knees injected tomorrow, so that's great. So, I think that's a really good option. We talked about this a little bit before. Osteoarthritis is a breakdown of the lining of the joints. And so every joint in the body, be it, the hands where we have all these bones, between every bone there's a joint. And the joint is what is the articulation. It allows us to move. And there's, small joints like in our fingers and in our feet. And then there's a lot bigger joints like in our knees, in our shoulders, in our hips. And the bigger joints especially wear down. And, the small ones do too. But the big ones especially impact our function in terms of being able to move. And so that's where, different modalities, including diet and exercise, especially exercise where, if you get some form of non-weight bearing exercise like swimming or biking, that can really strengthen the muscles and unload the joint, which can be helpful. I've got further comment in terms of the injections that helps my mental health, anxiety when you have relief from extreme pain. And certainly, extra weight, obesity can play a big role. And lymphedema, which is a very underreported and underappreciated issue that people can struggle with and can struggle with after cancer, can struggle with after various treatments, and can lead to, or after surgeries, can lead to weight gain. And weight gain is, one of the lead risk factors for osteoarthritis, for wearing out the joints. So what other questions do we have out there? Love to entertain, any issues that you've got, any unknowns, any uncertainties. We've got a question in terms of just a couple questions. One in terms of the current hospital situation in Port Hardy in the North Island. Unfortunately, we've been closed for the past 2 years as an emergency room. We're only open till 5 p.m., not open in the evenings, which in my opinion isn't a functioning emergency room. And that's a challenge. And so Port Hardy Hospital the Emerge remains closed after 5 p.m. And it's not quite clear why this is happening. I think that's a question for the Health Authority, Island Health, and certainly our MLA, who's the opposition health critic, Dr. Anna Kindy, has been very outspoken in favor of reopening the Emerge. Got another great question, recommendation for a treatment for uremic pruritus. So uremic pruritus, again, often you can look at these conditions and break down, what it means. So uremia means that there's an excess of urea, and urea is a breakdown product of proteins in the body, and it's excreted typically by the kidneys, but breakdown produced in the liver. And pruritus means itch, so that's the Latin term, uremic pruritus. And so, recommendations for a cream for excess urea and leading to itch. So, one of the questions, first of all, is why is there uremia? So why is your urea level high? Sometimes and commonly this is a result of declining kidney function. And so it's important to be aware of that and follow your kidney function. There's good medications that can help improve kidney function. So that's important. So, in terms of all patients, it's important to, just doing a review, make sure if you're end-stage kidney failure that you've got dialysis, that you're getting good treatment, that you're getting the right dialysis, making sure your thyroid, your parathyroid is checked, that your calcium and magnesium levels are checked, and that your parathyroid hormone has been checked. So, and then skin emollients. And so topical emollients, these don't have to be fancy medications. So these can be over-the-counters. So these can be, various, again, if you ask your pharmacist for an emollient, and so, classically a Vino cream is a very good one. Vaseline Creamy is a very good one. These are all very effective ones. If things are getting worse, you may find a topical analgesic might be helpful. So, that may be, for example, a topical steroid cream may be effective, like Betadine or hydrocortisone. Otherwise, you may try an oral antihistamine. Certainly I find this helpful for my patients that struggle with uremic pruritus. And so taking, typically a non-sedating antihistamine is better. So Claritin or Reactin, also known as loratadine or desloratadine, you can take 10 milligrams. And it says on the package 10 milligrams once daily, but again, you can get away with taking it twice a day without any issues. And typically that can help with the uremic pruritus. So to your question, use topical emollients like Vaseline Creamy or a Vino cream and antihistamines. Got some nice comments here, appreciate them. And what else? Challenges in terms of, in Port Hardy on the North Island, we've got, a number of First Nations communities. There's a lot of challenges in terms of trauma and meeting the needs of a population that's had generations of trauma, be it residential schools, forced displacement, and then ongoing issues with the child and welfare state. So these are all part of, what we need to do in terms of providing healthcare is meeting people where they're at. And so the North Island Community Health Center, we strive to provide a welcoming space where, patients can obtain and receive culturally safe, trauma-informed, and accessible care. And so that's all, key to providing the care that is needed. And it's not easy. These are, issues that we need to come back to and reassess and reflect on and do our best. And sometimes doing our best isn't good enough. And so that's part of, what we need to be mindful of. So I appreciate everyone joining today. I'll give it just 30 seconds more. I'm going to take a bite of my apple. If there's any further questions, please put them up in the comments. Otherwise, we'll wrap up our Facebook Live today. I appreciate the kind comments and everyone joining today. It's been another good opportunity to do this Facebook Live. We will do it again, so stay tuned this office hour. And otherwise, meanwhile, don't forget, an apple a day keeps the doctor away. So have a good rest of the day, everyone. Bye for now.